Welcome. The interview you're about to watch is with one of my favorite people, a doctor who has been promoted in healthcare faster than just about anybody I know and has been driven by a passion to change the system. His name is George Fields, and I interviewed him as part of my Enneagram and Leadership series, which is why you'll notice that when I ask questions, I keep trying to pull it back to themes from the Enneagram number. So George is an Enneagram 2. But the thing that you'll notice is, while you'll see strengths that are inherent to the Enneagram 2, and you'll see themes that are part of the Enneagram 2 journey, you're also going to notice some really important things related to leadership growth that have nothing to do with any particular Enneagram number. It's just part of the leader's journey itself. So some things to watch for. Notice from a leadership perspective in general that sometimes the worst things that happen to you, the things that shake you up, are the ones that actually lead to major growth. So I hope that gives you encouragement if you're facing anything kind of traumatic or challenging in your current journey. It seems like the most challenging things, and this isn't just with George, it's happened with most of the clients that I work with, when they go through these big traumatic things that shake them up, either shake up their thinking or shake up their situation at work, that usually paves the way to tremendous growth and really leveling up to a whole new way of working. The other thing to notice are the Enneagram 2 natural strengths. So you're going to notice the commitment to service. Another thing that you're going to notice is coming from love, really just coming from love, that is very distinctive of the Enneagram 2. And you're also going to notice a couple of challenges that the 2 faces, which is learning how to be direct with people and give direct feedback, and also learning how to lead a team to do well. I love working with George. I love knowing George. I'm so grateful to him to have been willing to do this interview with me. One thing also to note is he's actually already moved on from the position that he's in when I did this interview, and he's continuing to further his purpose in the world in a powerful way. So, with no further ado, here is George.
Welcome, everybody, to our Enneagram and Leadership series. Today, I have with me George Fields, who is the Chief Medical Officer at California MA Bright Healthcare. Thank you so much for being with us today, George.
Happy to be here, Nate.
So appreciate it. So today we're talking about leadership growth, kind of the path that we take on our journey as a leader. And I'm wondering if you would be willing to share a little bit about your journey as a leader, kind of what maybe some of your natural strengths were related to your personality that really kind of gave you a leg up in terms of leadership, and then maybe a couple challenges that you faced that maybe you had to overcome to be a better leader.
Absolutely. I would tell you that I come from a fundamental belief system that says the healthcare system is broken, and that I have a spiritual imperative to do something about that it is important to not just make marginal improvements, to make meaningful improvements that are dramatic. This is like a belief system, a core set of belief systems that I have. So when I went into medicine, I wanted to change the world. And of course, the story goes, don't try to change the world, change yourself. And naturally grew to leadership positions everywhere I was, because it was not okay for me to see something that was wrong or wasn't working. I had that spiritual imperative, something inside me that drove me to say, this isn't working. We have to do better. Let's try something to do something better. And I did that again and again and again. It was the year 2000. I'm CMO of another company. My mom died, took a week off. She died in hospice and end of life care. I'm medical director at at a hospice. And yet when I came back from my mom dying, I had 4 death certificates sitting on my desk. And it was a combination of my mom dying. It was a combination of taking a week off. It was a combination of 4 death certificates, very unusual. You have partners, they have to sign these within 24 hours. So I decided, something's wrong here. This doesn't make sense to me. I looked at the 4 charts of the lives that died. One was somebody that I knew was dying, that I couldn't convert to hospice, and she died getting CPR in an emergency room, hooked up to machines and tubes. The other 3 people that died, I hadn't even predicted were dying. And 2 of the 3 died in hospitals getting CPR, and 1 of the 3 died in the nursing home just in the evening before, she was found. And I realized that as much as I believe in hospice and end-of-life care, I didn't know how to identify those in the last year of life, certainly not the last 6 months of life. And when I did know how to identify it, I didn't know how to convert to hospice and end-of-life care and have a good death. If I've given true informed consent, I don't mind somebody choosing to go the route of, getting CPR and all of those things that happen. But if I haven't given true informed consent, that really bothers me when somebody ends up like that. And so I realized that I was part of the problem. I realized I was part of the system that was taking care of lives, discharging them out into the community where they were going to end up in the hospital, end up in the skilled nursing facilities again. I was going to make a lot of money taking care of them, thinking I'm doing good things. And I was going to send them out into the community just to have that cycle, continue. And I prayed about it, and I said to myself that I needed to change this, and it wasn't okay with me. And so I went out and actively sought to learn how to figure out how to have lives be identified that were in the last, 6 months of life. And it took me a couple of years, but I did figure it out. And then, how do I convert to hospice and end-of-life care if that's what they really want, when I do figure that out? And so, it was transformative. And out of that, I created a new health plan that literally best in the country. All of this is public data, best in the country quality outcomes. Very proud of it. So I would tell you that part of me that realized the healthcare system was broken, something that was fundamental, it was just part of me. But realizing that I was part of the cabal, if you will, part of the problem, was shocking, and took my mom dying for me to really get my head around, and owning it, and then doing something about it, was transformative. And then, being able to learn a process of predicting a solution, and then, communicating with, a dear enrolled life that I was taking care of, their family, and, making a difference in the care they were receiving. All of that came to play in, creating me as the leader of a new health plan. I'll tell you that I saw myself as such an integral part of that health plan, fundamental to the results that we were getting. I ended up getting, let go, replaced, and it was incredibly painful. I thought I would retire there and be there, until I went to heaven, really. That shock to my system of being fired from a leadership position and empowered position. I was part of the committee that hired the CMO for the ongoing health plan, larger health plan. And in that process, I was devastated. And it took me time before I could step away from it enough to look at my part in it and to see the wisdom and the growth from it. And, today, I look back at that moment of being let go as being the best thing that ever happened to me, because I'd never be where I'm at today if I didn't, have that happen to me. if I didn't learn from that and grow from that, and take a deep dive in understanding how I got to that point, where I was let go. And today I am much more able to identify the opportunities that are before me and how to manage those opportunities that are before me way better than I ever did in terms of taking care of lives, in terms of building a team that takes care of lives, and in terms of that team getting to dramatic outcomes than I ever was back in my old health plan, which I would never have had happen if I didn't get let go. So
I love that story. It sounds like some of the key pivot points in your journey were these moments of shock where things happened and your whole paradigm of a system that you were a part of or that you were using or to move forward your passion, because really that's how you started all your belief. You're grounded in that belief and passion, right? So you really know what you want to achieve. And so that sounds like that's a very natural strength for you. And it sounds like the pivot points in your career is you're sort of driving towards that belief. And then something completely changes your paradigm about it. Like you realize something and you realize your role in it, and you realize a way that you can change to then elevate. I'm going to call it your mission, maybe elevate your mission to a new level with new players. When it comes to leading the people, or when it comes to the challenges, is there a difference now in how you lead people compared to maybe how you led people before a couple of these pivotal moments?
I am very much a people pleaser, and when I am not coming from my best self, I will default to people pleasing as opposed to being honest and direct. And so over the years, I learned that I needed to do that with myself and then do that with others. And I learned that people appreciate when you care about them and you're honest and direct with them. And so I would tell you that perhaps one of the biggest things that changed for me over time was recognizing that I'm a people pleaser, that it didn't serve me well, that I needed to be more direct and specific. The caring part is just a natural part of me that comes in spades. That was never a problem. It was the directness, the ability to see somebody and holistically, and then give them feedback specifically about what's working or not working from my perspective. When people know that you really care about them, they can sit back and really hear what you're trying to say to them in a way that I couldn't otherwise.
Yeah, and I would say that I'm also an Enneagram 2. So today, when we're talking about the Enneagram and leadership, we're going to focus in on the Enneagram 2. And the biggest thing about the Enneagram 2, as those of you who are listening can probably hear from George's story, is that there's a lot of caring there, right? So George's mission is for the betterment of the world. It's all driven by love. It's driven by caring. And the big challenge for twos in general is that we tend to care for others and put others ahead of ourselves. And so we need to learn to care for ourselves. And as we learn to care for ourselves, then we end up getting much better actually at caring for others because we have really good boundaries. So that's one thing that we might talk about. But what I love that you said, because this has also been a challenge for me as an Enneagram 2, is figuring out how do I combine and synergize really showing care and kindness while giving feedback that I worry might hurt somebody. And I know that you do that well now. We talk about it all the time, but was there a key moment or something that you figured out that helped? Because I know if there's twos watching this, that's what they're going to want to know. How do I give somebody negative feedback without ruining the relationship? That's what they're going to want to know.
One of my mentors back in the day, 20 years ago, told me that I was an iron fist and a velvet glove. And, it resonated with me. And it was an accident that this man, actually consciously told me that. And I realized that I wasn't aware of it, that it was just something that I was developing over time. This ability to care unconditionally, to see people, completely, and to give direct feedback. But once he said that, I decided to own that and consciously made the decision that that was who I was going to be. And I went out of my way to do just that, to be that caring person that I am, but also to care enough to give direct feedback. This is working. This isn't working. I see you. I see that you're struggling. You feel like you have the weight of the world on your shoulders. When I have the weight of the world on my shoulders, I don't do well. I forget who I am. I come out of a fear place. Typically, it means that I'm not sure of what the next thing to do is. And so I have to take a step back, slow down, remember who I am consciously, and then, figure out what is the next thing to do. What is the right path? I'm a believer. I would pray about it. I would ask for, wisdom from colleagues, from you, my coach, Nahid, that kind of thing. And when I, do those things, it comes across. People don't resent when I give them feedback, sometimes very difficult feedback, because they know that I care about them, and it's coming from a place of moving us towards, it's not acceptable to take care of somebody that has a bad outcome attached to it. It's not okay to check a box and say that we've done, the Medicare requirement, but we didn't get a different outcome with this life that we get to take care of. We have to go that extra mile to get to the outcome that, is attached to this life that we get to take care of.
One thing I really love and respect about you is you're so good at driving your team to results and outcomes. You're very clear mentally on what the outcomes need to be. And that's another thing that an Enneagram 2 can sometimes struggle with, is because they struggle with giving that clear feedback, they often don't drive their teams really well. But I can hear it loud and clear in you. And then, of course, I know that you're excellent at talking about how important those outcomes are. Anything that you rely on, either mentally or emotionally, that helps you really drive people forward?
I am somebody who can work really hard, out of balance really hard. I can lose myself, I can lose my family. And, it took me a long time to figure out that that doesn't make sense in any level, and to take a step back from that. And, God first, family second, everything else third, and live my life in that way. I used to come from the belief early on in my career that I could do it, that I could work harder and figure it out and get to where I wanted to go. But somewhere along the line, teams get to outcomes way better than individual hard effort and work get to outcomes. And that if I was going to get the results that I wanted to get, for, 100, 200 people, I could do it by myself, but the goal wasn't to get results for 100 or 200 people. The goal was to practice medicine this way across the country. Most people want to die at home, as an example. 85% of Americans, maybe some states are in the low 80s, some states are in the high 80s, low 90s, but the average is 85%. And yet, 30, 40% are dying in hospitals, 20, 30% dying in nursing homes, not even close to 85% dying at home with loved ones around them. And I want to change that. I want to improve the quality of care that happens at the end of life. I want to improve the quality of care that happens, with death and dying. And there are things such as a good death that's very possible to have. Most people think hospice is about death and dying, but it isn't at all. It's about life. It's about living. It's about, how do I make today a good day and tomorrow a better day? Believe it or not, people live longer when they go on to hospice sooner than when they go on to hospice later, because they stop getting all these things done to them that cause them to die quicker, sooner, faster. So teams get to outcomes, not individual hard, effort. even as I work hard, I work less today than I ever did in years past, and I get more done today than I ever did in years past because of this growth on my own part.
I love that. It's interesting because you're also talking about another key issue for Enneagram 2s, and that's setting boundaries. A 2 generally will end up overworking themselves and then resenting it. But I think your kind of epiphany about how you could work, 14-hour days or more and make stuff happen, or you could really empower this team around you and you could make much more happen is really, really powerful. So it sounds like you've also struggled with that in terms of having to learn to set boundaries. One of the stories or the examples or the metaphors that we always use with Enneagram 2s especially is the oxygen mask on the plane. And we almost have to slowly walk them through this idea that, what do they tell you to do on the plane if the oxygen masks come down? And some of them don't even get this whole idea. Like they don't compute or they block it out, but they're still very bewildered about this idea that they have to put their own mask on first before putting on the child beside them. And so I say, okay, what if you decide that you're going to put on the child's mask first? What's going to happen to you? And we literally walk through how you're going to lose your decision-making capability. You're going to fumble with the child's mask, and you're going to be losing your functionality. And all the people around you are now not only going to have to help with the child, they're going to have to help with you. So you're making life difficult for everybody by not getting your needs met. And sometimes that metaphor can be really powerful to a 2. Was there any pivot point in your life where you had kind of a wow moment about that? I know I've had several of those, I think, where I've just learned that and now I have great boundaries, but where I've just learned that if I'm not putting my needs first, I'm not doing anybody else any good.
It's a great analogy, the oxygen mask, because I will tell you, it's never made sense to me. I must be an Enneagram 2 in spades. It's never made. I know I'm going to put it on my kids first. Are you kidding? It's the way I think, and so I get what you're saying as an analogy to bring it home. Working hard and getting individual results. People used to say, oh, that's George. George can do it. You said 14-hour days, it would have been 16-hour days in my case. The epiphany was using George, blaming George. Oh, George is doing it. I can't do it. And that wasn't okay with me because I knew I would never get to where I wanted to go if it was perceived and sensed as it was George and his 16-hour days and out of balance. And I realized that I had to live within a personal set of boundaries that showed that I was able to do this in an 8-hour day, that I was not only able to do this, I was able to teach others to do it in a less than 8-hour day, and created a clinical model of care where, literally the job description was a 6-hour day. And I expected them to get done in 4 or 5 hours most days, average day 6 hours, knowing that some days, some of these tough discussions just take time, and you never know when they're going to happen sometimes. Most of the time you do, but sometimes you don't. And so you do need to take 8 hours. And I wanted to create a model that was sound financially, sound clinically, but created the opportunity for there to always be time to do it. And so that's why I created a model with a 6-hour day attached to it. And it worked. It worked fabulously well. And it wasn't George doing it. It was my team doing it. As soon as I got my team to do it, the whole, oh, it's George, and it was related to my hard work, went away, just disappeared. People stopped saying it altogether.
Let's imagine that we have a young person come who very much like you, maybe their passion is different, but they have a strong belief or a
Mhm.
strong passion that they want to do great things in the world and they want to be a great leader, and they're also an Enneagram 2. So they
Mhm.
struggle with some of these same kinds of things. What are maybe three core tips that you would give them kind of at the start of their career to get them off on the right foot?
First tip is, be in the trenches. Don't be too far up the ladder. The farther away that you get from the trenches, the more mistakes you'll make and the more bad decisions you'll make. So I have, leaders that are above me. You have this model where my team was, 100 and some, nurse practitioners, physicians, physician assistants, very highly paid, right? That were working 6-hour days. And it made some people nuts. Okay. It didn't matter that we were getting better clinical outcomes than anybody in the country. And by the way, when you get really good clinical outcomes, there's way more than $1 left at the end of the day. So we were, positive from literal day one. But these were physicians that got further and further away from patient care, and they didn't realize, what it took to actually get to those outcomes. And they started making decisions. Well, your ratio is, this to that. So, stay close to the work, stay close to the trenches, really become an expert. But even as you become an expert, you never want to stay there. At least I never wanted to stay there. I just never got far away from it. I still see patients today. I still, touch the work that I'm asking others to do. I never do or ask anyone to do anything that I wouldn't do myself. Second thing I would tell you to do is remember who you are. Stay close to who you are. My mom taught me love was the answer no matter what the problem. And I stayed true to that. I stayed close to that, even in the times of my darkest times, even in the times of my greatest achievements. Love was the answer. So just remember who you are, stay close to that. Third thing I would say is, start doing, what's necessary. Don't focus on the long-term goal, even though I always had a long-term goal. Just do what's necessary, do what's right before you. Pretty soon you're doing, the impossible. Not because you started out with the impossible, it was overwhelming to start with. Just do what's necessary, what's right before you. In my case, it was setting up a clinical model of care that was different, that was unique, I had to work hard to sell. But setting up that clinical model of care and then, going out and getting results with that clinical model of care as an example.
Oh, thank you so much. So I feel so lucky to have some of your time to go through this, and it's just been a pleasure to talk to you. Any last words for anyone that happens to be listening to us today?
Yeah. You make a difference. Go out and live your life, make a difference. I wholeheartedly believe in, each of our abilities to, be the change in the world that we want to see. And there's a lot of change that needs to happen in this world that we want to see. Just be the change. It's a Mahatma Gandhi quote, but be the change you want to see in the world. And, it'll take care of itself. Be yourself, be your best self.